The measles outbreak is spreading fast. Here's what you need to know. The situation is becoming increasingly dire as the number of cases continues to rise at an alarming rate. Health officials are urging the public to take immediate precautions to prevent further spread of this highly contagious disease. As of April 1, 2025, Texas is experiencing a significant rise in measles cases. The state has been grappling with this outbreak for several weeks now, and the numbers show no signs of slowing down. Communities across Texas are on high alert, with local health departments working tirelessly to contain the spread. The state reported 422 cases, up from just 400 on March 28. This rapid increase in such a short period is a clear indication of how quickly the virus is spreading. Hospitals are becoming overwhelmed, and medical staff are working around the clock to treat those affected. This surge is most notable in Gaines County, where cases have climbed to 280 from 270 in just a few days. The local community is deeply concerned, and efforts are being ramped up to provide vaccinations and educate the public about the importance of immunization. New Mexico is also seeing an increase, with 48 total cases reported. The state is taking similar measures to Texas, with health officials working to track and contain the outbreak. Public health campaigns are being launched to inform residents about the symptoms of measles and the steps they can take to protect themselves. The majority of these cases are in Lee County, which borders Gaines County, Texas. This proximity has likely contributed to the spread of the virus across state lines. Communities in this area are particularly vulnerable, and cross-border cooperation is essential to manage the outbreak effectively. Meanwhile, Oklahoma has confirmed 10 cases. Although the numbers are currently lower than in Texas and New Mexico, the situation is still concerning. Health officials in Oklahoma are monitoring the situation closely and are prepared to take action if the number of cases begins to rise. Nationally, the situation is alarming. The outbreak is not confined to just a few states, it is spreading across the country. The interconnected nature of our communities means that an outbreak in one area can quickly become a national concern. As of March 27, the CDC has confirmed 483 measles cases across 20 jurisdictions. This widespread distribution of cases highlights the need for a coordinated national response. The CDC is working with state and local health departments to provide resources and support in managing the outbreak. This number surpasses the total of 285 cases in all of 2024. The dramatic increase in cases from one year to the next is a stark reminder of the importance of vaccination and public health measures. Experts are analyzing the data to understand the factors contributing to this surge. This makes the current outbreak one of the largest in the past decade. Historical data shows that while measles outbreaks have occurred periodically, the scale of the current situation is unprecedented in recent years. Health experts are comparing this outbreak to previous ones to identify patterns and potential solutions. States affected include Alaska, California, Florida, Georgia, Kansas, Kentucky, Maryland, Michigan, Minnesota, New Jersey, New York, Ohio, Pennsylvania, Rhode Island, Tennessee, Texas, Vermont, and Washington. The widespread nature of the outbreak means that nearly every region of the country is dealing with cases, making it a truly national issue. Experts are sounding the alarm. They are holding press conferences and issuing public health warnings to ensure that the public understands the severity of the situation. The message is clear. Immediate action is needed to prevent further spread. They warn that low vaccination rates are leaving communities vulnerable. Despite the availability of vaccines, some communities have low immunization rates due to vaccine hesitancy and misinformation. This is creating pockets of vulnerability where the virus can spread rapidly, and predict the outbreak will continue to spread in the coming weeks. Models and predictions from health experts suggest that without significant intervention, the number of cases will continue to rise. Public health officials are urging everyone to get vaccinated and follow recommended guidelines to help control the outbreak. So, what can you do? There are several steps that individuals and families can take to protect themselves and their communities. Staying informed and following the advice of health professionals is crucial. Ensure your family's vaccinations are up to date. Vaccination is the most effective way to prevent measles. Check your vaccination records and make sure that everyone in your household is fully immunized. And stay informed about local health advisories. Health advisories provide important information about outbreaks and recommended actions. Keep an eye on updates from your local health department and follow their guidance. Stay tuned for more updates on this developing story. The situation is evolving rapidly, and new information is coming in all the time. We will continue to provide updates as we learn more about the outbreak and the efforts to control it. Your health and safety are our top priority.